Good afternoon, everybody. I would go around and give out hugs and kisses to everybody because all of you are important, but there are folks who are apparently not in the room, and so I just want to hug y'all from a distance. But today is really important, and let me just say this was not my idea. You will be introduced to the person whose great idea this was, but I think today's event is very important because you will hear from some of our colleagues from home and also colleagues from afar about dreams and aspirations. And from my perspective, we all have to aspire towards some aims, right? Our personal aims, our professional aims, all of which are important. And so it will be, I think, a learning experience to hear from our colleagues who are in front of you, but also an experience for you to contemplate, where do you want to go? Who do you want to be? And how do you want to get there? But the most important message from me is that even as you're thinking about your aspirations, that you think about the present and the fact that you are in a present, and you and all of your colleagues need to be considering what is it that you're contributing now, right? Even as you are thinking about where you want to be and who you want to be. And given where you're sitting, no matter where you're sitting, if you're at our other campuses, you're sitting in a place of healing and a place for caring. And so I would hope that not only because you are currently in healthcare and you're currently a part of the One Brooklyn family, that as you're contemplating your aspirations and where you want to be and who you want to be, that at least that presence in healthcare and within One Brooklyn is a consideration. So I'm not going to speak for a long time because you know I can go on because it's so important for you to hear from our guest and from someone else who's part of the One Brooklyn family, Mr. Saul Torres, who is the deputy. I was trying to think of I could describe a lot of things that you are, Saul, but his official title is Deputy Executive Director for Brookdale Medical Center, and again, part of our One Brooklyn family. Thank you, Saul.
Thank you, Lorette. It's really a privilege to have the opportunity today to be called upon, first to be recognized by our CEO, Ms. Lorraine Brown, and then to have the opportunity to introduce this esteemed panel. I'm going to, each of the panelists had extensive bios, which I will not read. I've highlighted some of the things from them. So please indulge me as I fumble with the paper to try and pick out the important things to talk about today. First, we'll start with the person who actually had the dream, had the idea to inspire today's panel, Dr. Prasanna Alston. Although Dr. Alston is a native of Queens, we know that her heart belongs to Brooklyn. Dr. Alston is the Chief Nurse Executive for One Brooklyn Health and has been a member of the One Brooklyn Health family for 8 years. Prior to serving as CNE, she served in leadership roles in nursing, most recently at Bronx Lebanon Hospital. My next privilege to introduce Dr. Kerwin Gibbs, who is a Brooklyn guy, heart and heart. He arrived at Brooklyn when he was 10 and spent his formative years here, a product of the New York City public schools, as am I, and went through his medical training in New York State. He left Brooklyn for 20 years in his career, but he's back now where he got trained to become chairman, where he served as a chairman, a member of the Board of Trustees and chief of the medical staff, president of the medical staff at another hospital, and he brings all of that talent and experience here to OBH to serve as chairman of radiology. So Dr. Gibbs, thank you. Our next guest, it's a privilege to introduce Delvecchio Finley. Delvecchio and I know each other through the American College of Healthcare Executives, where I serve as a member of the Board of Governors. Delvecchio is our chairman of the Board of Governors, and we are all very excited to have his leadership and talent guide our 48,000 strong members across the country. Mr. Delvecchio.
It happened overnight. I appreciate it.
Take the easy route.
Yeah, exactly.
Promotion by me are only valid for the length of this conference. Delvecchio is president of Atrion Health, a part of the Atrion Health enterprise, one of the largest not-for-profit and leading academic health systems in the United States. As a member of the executive leadership team, Delvecchio is responsible for providing leadership and strategic direction for the meaningful and measurable goals that will position Atrium Health's strategic growth and success. We are really pleased to have Delvecchio here in Brooklyn. Thank you. Dr. Catherine Georges. Dr. Georges is a professor and chairperson emerita of the Department of Nursing at Lehman College and an adjunct professor at Mary Medical College. Dr. Georges is a leader in academic nursing, health policy development, community engagement, organizational development, and healthy aging. She is committed to assuring social justice and equity for marginalized and vulnerable communities. I asked Dr. Georges if there's anything else that she's most proud of on her background, and she said, yes, absolutely. Please mention that I served as the National Volunteer President of AARP for 2018 to 2020. And as I shared with Dr. Georges, someday I'll be old enough to join AARP. And now we have Dr. Torian Easterling. Dr. Easterling is a family medicine and public health physician. He was recently named as our Senior Vice President for Population and Community Health and Chief Strategic and Innovation Officer for One Brooklyn Health. Prior to this role at One Brooklyn, Dr. Easterling served as the first Deputy Commissioner and Chief Equity Officer at the New York City Health Department. As first Deputy Commissioner and inaugural Chief Equity Officer, Dr. Easterling worked to align the agency's external and internal equity initiatives, something that we've all been through. He led the city's equity response for the COVID-19 pandemic, including and ensuring equitable distribution of vaccines and populations to communities hardest hit. Dr. Easterling spent more than 7 years in a senior leadership role at the health department. Thank you all for being here today. Thank you, Dr. Alston, for having this dream. It's my pleasure to turn it over to Dr. Alston.
Thank you, Saul, and thank you, Ms. Brown, for allowing us to have this forum. As you said, I do think it is an important forum for us to have a discussion with our distinguished guests that are here present, because there are a lot of places and ideas and thoughts that a lot of us have that we feel is not achievable. So I'm going to give Mr. Finley Delvecchio Finley. Sorry, he has a dual role here, and he's just going to do an opening speech for us, presentation, because I tried to get him for Nurses Week, but I couldn't. So he has dual responsibility, and he's just going to give us a speech today in regards to basically the topic of this panel discussion is I Have a Dream, and basically saying change makers changing healthcare one dream at a time.
Thank you so much, Dr. Alston, and thank you all for this opportunity. Saul already mentioned we know each other because we share a board for ACHE together, and I really appreciate seeing you here, and our local ACHE chapter leader. And as mentioned, Dr. Alston, really, when you reached out to me and asked me for this, for Nursing Week, I was incredibly honored. Regret that I couldn't make it, but big shout out to the nurses, big heart love for all of our nurses. My best friend's mom is a nurse. My high school best friend's mom is a nurse, and the love of my life, second mom, I call her, and just an amazing person. And I just have deep and abiding respect for the profession and all you do. So I said that. And then, oh my gosh, Lorraine Brown. I have known Lorraine actually, I've known her longer than she's known me, which is probably the case because she is, I have to say this, I'm just a huge fan of all the work that you've done, particularly in New York, but around the country. I mean, I knew you when I was in California. California and was in a lot of rooms with her where I'm sure she didn't see me because everybody was seeing her. But it was great to run into you in August. And then I get here, or I'm sorry, in April in DC, and I get here and I'm looking at this constellation of folks that I'm meeting, and I'm like, this is not a coincidence. This is an amazing, special place. And these are just the folks I know. So the folks I don't know, I'm just like, my gosh. And then just meeting you, and I'm going, wow, this dude is pretty awesome. Notwithstanding the fake basketball incident. It was signing autographs, I heard. You probably work with Dave Chosky too, and I'm guessing, yeah, Dave and I were on the board together too. He's a great guy. I worked for Mitch Katz, who is now here twice in San Francisco and in Los Angeles, and I know he's back here in New York too, so doing great things with health and hospitals. I wanted to just offer a few remarks to set the stage for today. Change makers, making change one dream at a time. That word dream to me really sticks out, and Lorraine set the tone for us, I think, at the beginning here. You know, it's very interesting being here in New York. As I thought about these remarks, I went, you know, just shy of 100 years ago, there's a lot of things happening in the world, but certainly in New York. There was something called the Harlem Renaissance, right? Late 1920s. A lot of great poets, artists. One of my favorite, Langston Hughes, talked a lot about dreams. And he actually wrote a poem about dreams. And that poem says, hold fast to dreams. For if dreams die, life is a broken-winged bird that cannot fly. Hold fast to dreams. For when dreams go, life is a barren field frozen with snow. So he really underscores the importance of dreams right there, right? The dreams are so important to hold on to. And I want to share a story to you that I call A Boy, a Dream, a Girl, and Cory Booker. Before I go, yeah, I know, I threw you for a loop there. Before this goes, does anybody know Cory Booker? Anybody related to Cory Booker? All right, so don't tell him I talked about him. I'm going to talk about him. Okay, cool. All right, here we go. A boy, a dream, a girl, Cory Booker. Here's a boy. He was born in a safety net organization in a major metropolitan area, not this one, but much like this. Raised by a mom in a single parent household, public housing, younger sister, or a sister and a brother. But all the images that public housing, what we some call, government housing, the projects, the PJs, all those images that conjures for you was this boy's reality. Things like abject poverty, right? Weird and unsustainable housing situations, drugs, alcoholism, violence, friends dropping out of school before 6th grade, crime. All those were a part of this boy's reality. But what was also a part of this boy's reality was unconditional love. Love from family, from friends, nurturing and support from teachers, religious leaders, community leaders, civic leaders, all those people who saw in this boy a dream, who saw in this boy an opportunity, who saw in this boy potential. Also an example from an aunt who was a tenant association president who spent a lot of her time advocating for people who lacked their own voice, who were at risk of losing their housing, at risk of losing governmental assistance, but really fought for them. So he had that example. This boy cultivated a dream. His dream was based off of two principles. One was that the people around him had more worth than they seemed to know that they'd had, and that people around them knew that they had. The other thing he felt was the people around him deserved more equitable access to health care than they had, because all the ills, both physical and behavioral, that were confounding his community were partly, and maybe in large part, due to inequitable access to health care. So the boy decided he wanted to be a doctor, but not just any doctor. He wanted to be a doctor, and he wanted to go back and live in the community, or a community like the one that he grew up in, so that he can show those individuals that you too can do this. This is not beyond the realm of possible. Plus, then he wanted to, on a practical level, provide care to those communities, provide access to care for those communities. So the boy came up with this crazy dream, bottled it up, piece of paper, put it in his pocket, went about his life. Went to a pretty good university. Dream got sucker punched twice. One was by a class called physical chemistry. and the chemistry majors in the room will get this, kicked that boy's butt to the point that he thought, maybe science doesn't love me as much as I thought it did. Maybe I won't be a doctor. Just hold that thought. The second, maybe it wasn't a sucker punch, maybe it was a love tap because it was a girl. This boy found this amazing sister. She was smart, she was fine. She was spunky. And the boy was just blown. And in one of these, nice romantic moments, the boy shares his dream with the girl. And he says, what he wants to do and where he wants to be. And the girl says, it's a lovely dream. It's got 2 problems. The boy says, what? Problems, my dream? Pray tell. She says, well, one, I think you are underestimating the pragmatism of the people you want to serve. It's like, what do you mean? She said, well, they're going to say, wait, you went to college, you went to medical school, you passed boards, you completed your residency, and you live here? Why would you do that, right? And I was like, wow, I wouldn't call that pragmatism. I call that cynicism, but I'll allow it. What's the second one? She goes, well, you're probably going to be single. And she said, I don't know if that's important to you, but you'll probably be single. And then she said, let me rephrase that. I like you, and I don't know where this is going, but I ain't living in the projects. And I went, I hadn't thought about that either. All right, fair enough. So boy and girl go about their life, move on. One day they're watching television, they read or hear it's an interview about this guy named Cory Booker. Cory Booker, Stanford grad, football standout, Rhodes Scholar, Yale Law, Mayor of Newark. I just learned today, Newark, not Newark, Newark. I just learned that, Newark. And then U.S. Senator, first African-American U.S. Senator from the state of New Jersey, right? 30 points for anybody who knows where Cory Booker lived. In the projects, ding, ding, ding. So the boy looks at girl, boom. So, Lorraine, you know I love you. So, boy looks at girl and goes, he's living my dream. Girl goes, wait, let's watch the rest of the show. Show ends, girl goes, they made no reference to a significant other. I believe he's single. Boy went, darn it, Cory Booker. Messed it up. Anyway, so that's the boy, the boy, the dream, the girl, Cory Booker. What happened? You know what happened to Cory. What happened to the boy? What happened to the girl? What happened to the dream? Boy marries girl, have a beautiful kid, go on about life. In 3 short months, boy and girl will celebrate 20 years of marriage. Really proud about that. What happened to the dream? Well, the dream morphed a little bit, but it didn't change. The boy didn't become a doctor. The boy didn't go live in public housing, but the boy became a healthcare executive. And the boy went to devote the lion's share of his career to working in organizations that served the communities that he wanted to serve, whose mission aligned with what he wanted to do. And not only did he, through those organizations, enable and facilitate equitable access to health care, he learned that it was more important to go upstream and focus on health. And so you got to get into those communities and do things like provide access to food, set up food pharmacies, set up farmers markets and things like that to help people get access to food. Because we have seen in our communities, people with conditions as chronic and dire as cancer have bigger problems. Where am I going to sleep tonight? Do I have any food to take my medication with? Do I have a refrigerator to keep my medication at the proper temperature, right? So he went upstream and started working on those things through this dream. This dream that really took him from being a CEO at a major healthcare system or a major healthcare organization in Los Angeles in his early 30s, running a health system in his late 30s in Oakland, and now becoming the first African-American CEO of a health system in Macon, Georgia, that is in a predominantly African-American community that has been that way for over 150 years. The first. And he's right here today. You figured that part out. Thank you so much for that. The important thing is not about what I did in terms of the accomplishment, and I appreciate that, is really about the dream. And so the question becomes, how did the dream endure? How did the dream withstand the blows of life that it took it through? Mind you, it's not the same. True, right? But it endured. The dream, the ultimate crux of the dream of giving people who look like you, who came from your background, worth, and then helping them to get access to health care, happened. Didn't look the way he thought it would, but it happened and is happening. I'll tell you why it did. A lot of times we go through life we focus on, Simon Sinek talks about this, the golden circle. We focus on the what, the why, the what, the how, and the why, in that order. I'm going to do this is how I'm going to do it, and this is why I'm going to do it. Effective leaders do the reverse. You start with the why, then you get to the how, then you get to the what. When you start with the why, it's the purpose. It's what you are doing it for, right? And then whatever you want to do actually can take on many forms. More forms than you might even be able to conjure in the moment, right? If you're so fixated on the what, you might lose. It's like missing the forest for the trees, right? So you start with the why. You start with the purpose. In my organization, we do something called Connect to Purpose. And in every major meeting, board meetings, committee meetings, exec meetings, key staff meetings, we have somebody stand up and we say, share a story that happened with an interaction with a patient, a family member, a community member, or another teammate. Something that connects you to why you get up every day, what's your purpose, whether you're clinical or non-clinical, how are you manifesting who you endeavor to be, why you came to this organization, what wakes you up, why does it matter, right? So those connected purposes remind us that, and they do exactly what I'm talking about. They start with the why. They remind us of our why, so that then the what that we do every single day, the interaction with a different patient, the interaction with a family member, can morph. It doesn't have to be exactly what you thought it would be. If you go the other way around, the moment that derails, you derail. I could have gone on to be a banker, I don't know, fill in the blank. I could have gone to be anything else. But it may not have been true to the why if I didn't start with the why. So my supposition is that the dream endured because the why endured. It was rooted in the purpose. So my message, and what I hope we'll talk about today, is staying connected and rooted to your purpose, your why, and let everything else take care of itself. So I started with Langston Hughes. I'm going to end with Langston Hughes. Langston Hughes had another poem about dreams. It's called Harlem, and he asks us a bunch of questions in that poem. He says, "What happens to a dream deferred? Does it dry up like a raisin in the sun, right? Or does it fester like a wound and run? Does it smell like rotten meat? Or what does he say after that? I forgot. Wait, does it fester, or does it smell like rotten meat, or does it dry over and like a sugary glaze, or dry over in sugary glaze like a syrupy sweet?" That's what he said, like a syrupy sweet, right? Or maybe it sags like a heavy load, he says. Or does it explode? What happens to that dream? I think the answer to those questions are, it depends. If you start with the what, then the dream does dry up like a raisin in the sun, potentially. If you focus on the what too much, it will smell like a rotted meat. It will, go in the opposite direction. However, you start with the why, it might fester a little bit like a blister, but it's going to run. It will glaze over like a sugary sweet. It will explode if you start with the why. So my message to all of us today, particularly us who are all of the folks in this room, all of the people watching us virtually, is that the mission that we have to provide equitable access to care, high quality care, the work that you all do day in and day out here at One Brooklyn, across all of One Brooklyn, is so important. And that dream is not deferred, but it's still going. So let's stay committed to the dream. Let's stay committed. Let's stay rooted to our why. And let's be those change makers who are going to change healthcare one dream at a time. Thank you.
So thank you very much for those words, Mr. Finley. And it's a segue right into my first question. And, as I was thinking about this whole panel discussion that we're going to have, and I do want it to be very interactive. So I'm not going to call on either one. Please engage one another in regards to conversation and the audience that we have here. I thought about it, and I said, Dr. King. And he had a lot of quotes that are very, very suitable to the times that we've been in, the times that we're about to approach, where we were, and just some things that have changed in regards to government. So the first thing I want to discuss with you all is a quote from Dr. King. And it basically stated, the ultimate measure of a man is not where he stands in a moment of comfort and convenience, but where he stands at times of challenge and controversy. COVID has changed our lives dramatically. Whether we're lay people, healthcare providers, has exacerbated staffing challenges, has exacerbated, just overall healthcare, and has demonstrated also resilience in regards to healthcare providers. My first question to the panel is, what changes have you seen because of COVID in healthcare? And the other piece of that is, what new direction, area of focus decisions have you taken within your sphere of responsibility as a result of COVID to prepare for the future of healthcare?
I just talked for a long time.
I'll jump in.
I don't want to be rude.
I'm the rookie here. Yeah. That's okay. I can. Okay. All right. I always want to check with my elder. So I'm okay.
Smart man.
No, she's
right.
talking. That's it. It's wisdom.
Wise.
It is. It's wisdom. It's such an honor to be here on this panel. I should be in the audience. I told Dr. Alston, you don't need a panel. You got Mr. Finley here. All you need is Mr. Finley to speak. I was mesmerized. Were y'all mesmerized? I was literally just sitting here like, okay, what else? What else? But I think it's so important to be sharing the wisdom that we have learned, but also to be in dialogue with each other, because we are all and have been going through challenges, particularly over the last 3 years. And so, I've been certainly thinking about certainly where I've been standing in these moments of adversity. And as I look across this room, there have been multiple moments of adversity that this community has faced, that our city has faced. And I think one of the things that has been so important is the way in which we have come together. We have been so amazed in the way in which communities have organized themselves, have systems and institutions have organized themselves. And I think as we think about, sort of what the next chapter holds for us, it's really making sure that we continue to stand shoulder by shoulder, looking at the person in front of you, next to you, and making sure that you know that that person is going to continue to advance the mission. And I think that is really important. Coming out of government, where there was always questions about who was making the decisions, where our resources were coming from, how we were going to organize and really bring together different institutions and leaders to make sure that we were providing resources for our community. At some point, we had to stop asking whether everyone was committed. We just had to move forward. And that's what, I think is really important for all of us. We folks have been here. I'm the newest kid on the block for this system. And I've seen the ways in which people have stood up, have for each other, stood up for the work. And I think that's really important. The respect that folks have for one another, we want to continue to carry it. And I think what has been really important in some of the work that I'm taking with me into this system and working with all of you as we think about sort of like the next chapter, as Dr. Alston had asked. Specifically, I think it's really defining equity. Because we've been using the word. Everyone is throwing it around. Equity, we want to do equity work. And certainly what I always talk about, is the simple part of center yourself. How do you want to be treated? How do you want to be valued? How do you want to be respected? And the care and the service that one is providing. Define it. And that's how you can make it real for the next person. And so it's not necessarily just trying to define the person and the circumstances that they are in. We go to it so easily. We try to define someone is food insecure, someone is not dealing with housing. But you can also define it in a way in which people could be educated, could have resources, could have an appropriate income. And we see this with our Black maternal rate. And so it's not enough for us to define someone by their circumstances. What we're saying is that the conditions in which people live in is not equitable for every single person. Not every single person. So if you center yourself in a way that you understand what it means to be truly valued in every service, in every care that you receive, try to have that for every single person. That's equity. That's what we want. That's what we want for everyone. And so how do we achieve that? And so I would always say that it's really important that we define it first. We have the language. We absolutely need the language. We want to make sure that everyone understands truly what it means to advance it. And so we start with this education, and I think it's really important that we ensure that everyone has the capacity and the understanding and knowledge to do that work. Because we certainly want to make sure that as we continue to rise all tides, that all boats are going to be lifted. And so that's what I'm carrying into this next phase of our work as we come out of this post-pandemic era and saying that I need all of you. You need me, I need you to move this forward.
Yeah. And I'm going to jump on as Dr. Iselin said, where he said we need everyone. Because when I thought about that issue, I remember the times during COVID, what struck me was, I'm a physician, and I'm supposed to be this really valuable member of the team, but you'd have sick patients, and actually I felt like the most valuable member of the team would be the nurse or the respiratory therapist, the people that were actually with the patients, the person that brought the meal into the room, were putting themselves in harm's way, person that, basically turned over the room from one patient to the other. And it really emphasized how it's a team, like everybody is valuable. And sometimes in the whole process, some people that are not valued turns out to be the most valuable person of that team, because end of the day, that's a person that was actually, those are the people that were putting their lives in harm's way more so. I mean, a lot of my colleagues, I'll skip this out, I'll stay home. I can do this on the computer. But I know respiratory therapists couldn't, and some of the nurses couldn't. People cleaning the rooms couldn't. And those were the people that were truly valuable in the next patient staying alive. So I thought the one thing I reflected on the most was, wow, everybody, it's a team, and you're supposed to value everybody in the team. And this really shows how valuable people that sometimes you take for granted, but everybody's part of the team and everybody should be treasured. So that was kind of like what I remember thinking about on a day-to-day basis during the time, especially, my mom, elderly person in Brooklyn, COVID's rampant. She had a pre-medical a lot of conditions, and just the fear. And then you think about we need these people to help her, and then you realize, well, when I would take her to a doctor, it's a lot of times you're just like, wow, thank you, just for being, the let's say the secretary that's working with the doctor. Thank you for being open. Thanks for, thank you, because everybody was not. It's not just the doctor. It was everyone. So that's a part that just springboarding up what you said. We need everyone. That's what.
And you're both so articulate about that, because one of the big things that I saw that came out of this whole pandemic, besides, is the we. It became we, not the me, not the I. And the appreciation of what happens in community. I have to say that, hospitals may be in communities. They were not of communities. And if nothing else, they had to become part of that community, because they had to take care of people they never thought would enter their doors. And now we see, and I always remind when I teach community health, which I do, is if you live to be 100, there will only be a drop in time that you will be in any acute care facility or long-term care facility as you look at your lifespan. You're going to live in community. We have got to engage communities. And I saw what came out of this was more community engagement, really reaching into communities and saying, hey, who are your influencers? Who can we get to? Who do we need to go talk to, the Mr. Finleys of the world, the Miss Browns of the world that run in these huge systems, the doctors, and if as a nurse, nurses became a critical factor in the existence of hospitals, along with all the other allied help. And they felt, and I hear from the graduates, they felt if at no other time, they were part of a functioning team whose outcome was to save lives if they could. And if they could not save the lives, to make the transition for that person and for their families much more important and something that they could do. And the importance of what they do every day. And I would have graduates call me. I told them they can call me anytime, any hour in the morning. And they'll cry because they just bagged a few more people. But to have one of the things that that we really learned, and I just finished doing my outcome of my study of Black nurses in New York and Los Angeles. One of the biggest things that those nurses said that was the most important for them during this pandemic was having somebody to talk to. And institutions opened up lines. The National Black Nurses had a open line where people could call. But that was the most important, and they felt that they begun to interact with people they never thought they would, and it's become part of what they do now, and they feel better about it.
So thank you. And I will say that here at One Brooklyn Health, and I am going to say I thank Ms. Brown, because I will tell you that was a very trying time. And no matter how many times I went to her, I didn't have any words, and she just would look and just give the solace to know that she was there for support. So thank you all for your response to that. So when I come into work early, and I listen to Donnie McClurkin. I listen to Donnie McClurkin to give me some peace and to bring me into a zone for when I come into work, I can think clearly, respond appropriately, and just think about some of the words of the songs that I hear. They're inspirational music that I hear. And so he has a segment where he goes back and he repeats some of the participants that he has on his shows. And one of them was Maya Angelou. And Maya Angelou had stated, she asks, what does peace mean? And someone replied, without war. So she replied, true peace is the absence of tension. It is the presence of justice. We've lived in a time now where we've seen George Floyd, the incident. We're now living in a time where affirmative action decisions has been changed. I would like to ask you, what is the role of a leader in advancing justice in healthcare?
Please.
Yeah. The role of a leader. Number one, we have to listen as leaders. We have to be able to listen, show empathy, show compassion, be inclusive. Obviously, you're going to be detailed and really be focused on the decision that needs to be made, but how are you bringing others along with you? And so as you talk about this point around tension and justice, because I think it's so valuable. I have several interns that are working with me. I call them scholars. I want to acknowledge them. We were talking about the Supreme Court. We were talking about the Supreme Court related to the affirmative action. What are the implications of this ruling? What does it mean for you as you are matriculating through your own journey right now? And it's going to have a serious, serious impact on the students who are working with us right now, on the future generations that are coming up behind us. And so while we acknowledge our nurses, while we acknowledge all of our respiratory techs, while we acknowledge our amazing CEO, what does it mean in 5 years because of this ruling? And will we have the future generations who are trained and ready to take up the mantle? To take up the mantle that all of you are sitting in right now. And that's what I was saying that we're pushing for right now. We're pushing for our interns to make sure that they understand that their responsibility is not for the project that they're working on right now, but it is so much greater. It is so much greater. And that's the tension that we're always trying to fight with, because we just want to exist. We just want to be, can I just sit in the chair for 5 minutes and not have to take on the world? Can I do that? Is it possible? And that's the role that we often have to take as leaders of systems, but then as a nurse, right? On the 4th floor, there is so much that we have to take on. We're leaders in our own right. We're leaders in our own right. And so can we find that peace? That's the question that Maya is challenging us. Can we find that peace in the world that has been created for Black and brown people? And I would say that our ancestors have done so much for us to at least be a little bit more peaceful than they were. And we are thankful for what they've done, but we have to continue to carry it. And so it is our responsibility every day to continue to carry what has been given to us and pass it on. We can't be stuck with it. We can't be stifled with it. We have to make sure that our future generations know that that fight continues. That's the tension that we're always sitting in. Do you agree?
Me?
Yes. I just want to make sure. I heard
looked at me
dialogue.
like she
I heard
did. She was
dialogue.
like, what is he saying right now?
I want to make sure, as the young person.
Yes, and listening to the sage. But one of the key things that I've always felt about leaders is, Colin Powell said it well. Trust is the essence of leadership.
Yes.
Folks around you must trust you. They must trust that you understand what they're going through. They must trust that you're going to do it for the betterment of the society, not for you and what you gonna get out of it, whether it's a big salary or not a big salary, or public acclaim. And one of the key things about this whole removal of affirmative action, my grandson is 13 and he reads and he asked me, so did you go to school during affirmative action? I said no. I went to school long before you were born. But the issue is that as leaders, we have got to step out, speak up, talk back, show people that we're willing to stand up with them for what's right, because it's right. And that even with all this nonsense that has gone on, we can't retreat. Leaders cannot sit in their offices and in their wherever else they are and say, well, things will work out, I'm in charge. That's a nonsense. It's not going to happen. And you've got to have the collective impact. Leaders do not lead by themselves. They've got to have a group of people around them. You don't want them behind you, you want them alongside of you. Because being alongside of you gives you the impact that you need to make changes. So if they don't trust you, it ain't gonna happen. They trust you, Ms. Brown, otherwise they won't be sitting in this room.
and in other rooms.
Right.
And not just when the lights are on, too.
And the same for Mr. Finley and his large system.
I hope so.
Yeah, but for the justice that has to be done,
Yes.
and what leaders have to do is they must work constantly and consistently to make sure that those systemic barriers that Dr. Eastland talked about are removed. And sometimes they're gonna get wounded, and you gotta be able to duck and put up your arms and take the bruises. But you gotta do that, otherwise it's not going to happen.
That's what Dr. Eastland was doing.
Yeah, right.
Exactly.
Taking the bruises. Very, very, very well said. Well said. In healthcare leadership, there's I call him a guru, who wrote this book called Followership. And in the book about followership, a guy named Tom Atchison, he defined leadership. And he said, leadership is the ability to convince a group of people to subjugate their right for self-determination. We all have a right for self-determination. What I want to do right now, tomorrow, whenever. To follow your lead because they believe that you will get them somewhere further or faster than they can get alone. Together, than they can get alone, right? That's following your lead. She just talked about trust as a underpinning of why somebody would do that. Why somebody would say, oh, let's try your route, or let's go your way. The other thing is conviction. right? That you have we talked about a dream, right? You have a worldview that resonates with other people, and you are stepping out and willing to go out and sort of expose yourself and saying, here's how I feel, and here's what I believe. We're talking about Dr. King. Dr. King talked about there being two types of laws, right? Ones that are ordained by the divine and ones that are made by man. And that there will not be justice in the world until the ones made by man more closely align with the ones made by the divine. So he's saying that this stuff that we're doing, if it's not right, if it's not ultimately just, then we won't get peace. We won't get equity, right? We won't get those things that we're. So the fight is for us to work towards that. A leader has to have that strong of a compelling message, and then the leader has to realize that people aren't following you because they like you. They actually aren't following you necessarily per se, but they're following what you believe in. They're following what you're putting. They're picking up what you're putting down. Right? They're like, right on, I like that. I will show up for you because I'm actually showing up for me. And you're just opening the door, you're blazing the path, and I'm coming right behind you, right? That's what a leader does. Or actually the difference, a leader is a title. It's a noun. One who leads, the verb of leading, the action of leading is what we're talking about here. Creating the conditions that are fertile and ripe for the people who want to do the thing that you think is right to be enabled and empowered, inspired to actually do it. That's what you have to do.
And I'm going to, everything you said, I'm going to take it at another even layer to leadership. Everything that was said is 100% true. But sometimes what I feel leadership is so important is what sometimes kind of goes under the radar. Like when affirmative action happened, I mean, you could, once the court was 6-3, you could almost see that coming a mile away. And doing a little bit of research or just reading some articles, they mentioned the Heritage Foundation. And that's pretty much the people that led to this happening. And the person, I can't think of his name right now. Honestly, I don't, because it's not that important to me. But the one thing he said was, people are policy. So he had that was his thing. Like, I'm gonna, as a leader, you put people in places to make change. And so leaders get the right to just sign a piece of paper and make things happen. They'll become a leader with all the other attributes, but it's even more, it's like so important because of what they do when they get there. And silently, he put together a plan as a leader, and that led to affirmative action. And that was this thing, people are policy. I'm going to put people, I'm not going to make a policy. I'm not going to write it down that anybody can follow it. I'm just going to put people in certain places so things happen. And they were not just, exactly. Exactly. So, that's, yeah, right. And then another thing too is like leaders, and I'll try to be brief, but Winston Churchill always said, like, that's always stuck to me, goes, history will be kind to me. I know because I'm going to write it. I get to write it. And with Ron DeSantis, the leader, it's like he gets to write it. He's going to rewrite it. Yeah. So that's another aspect of why leadership is so important. You can't take it for granted. We have to.
I think what you're pointing out is leadership could be used in either direction, right? Yeah. So we're talking about it because in the concept of the question, it was how do leaders do this? What's the role of leaders for this? But let's not get it twisted. There are leaders who have visions and values and worldviews that are different and feel that their role is actually to go in a different direction and use the exact same tools and methods to do it. So you have to have the same conviction of your ways, if not more, to then affect a worldview that's more consistent with your own.
So thank you all. I mean, that was really thought-provoking. You know, you think about, I'm just sitting listening to the words and taking it all in. Mm-hmm. So another Martin Luther King quote, he said, "We all came over on different ships, but we are all on the same boat now." So, what do you envision the future of DEI as the springboard to being inclusive with sustainability? As well as, do you think that we'll be able to come together as a nation to eliminate disparities in healthcare?
I feel like you should start on this.
We'll just keep it.
I'm just gonna buy you some time.
Same rhythm.
I'm just your warm up act.
We'll go ahead and say the question one more time.
Okay, so I'll give you the
You set it up again? You gonna
Yeah, I'm gonna set it up
Dr.
again
King?
for you.
All right.
Because
good.
when I saw this, I said, this is one.
Plus,
heavy
I was
question.
moved by the church. Amen. That was real helpful. So y'all do that again, please.
Dr. King said, we all came over on different ships, but we're all in the same boat now. So, and what do you envision the future of DEI as springboarding, being inclusive with sustainability? As well as, do you think that we'll be able to come together as a nation to eliminate disparities in healthcare? Yeah,
so I think there are two things here that I want to try to unpack. I think that there is the action and then also what the intention is, right? I think we're certainly in this transition where we have to sustain the work of ensuring that organizations are becoming anti-racist. And I'm very explicit about that because I think that the DEI work has been co-opted by institutions, by organizations. It's being able to talk about, how diverse your workforce is, really how are we, supporting MWBEs. There's so much more when we're talking about, the process of becoming anti-racist. It's making sure that every single person, as I talked about before, who walks in your doors, that they feel welcome, that they know that this is in a place for them, they feel valued. How do we create that type of environment? That takes more than just making sure that you're going to hit a certain number, a certain threshold, that your staff is representative of the community that exists in your institution, right? There's a process and there's work. So I think that we're in this sort of transition, what it is and how do we get there and why it must align with your mission. Because as you talked about earlier, everyone got on the bandwagon. May 2020, George Floyd is murdered. Everyone is talking about they're going to be doing equity work. Everyone is doing DEI work. Everyone hired a chief diversity officer. And then just last month, a lot of people fired their chief diversity officer. We saw 5 Black women fired from some of the major media companies, including Netflix. I hope y'all, got rid of your Netflix account. But I think it's sort of losing that fad, and that's fine. That's fine. But the folks who are truly committed to it are going to continue to figure out ways in which we sustain that work. We transform it. And I think there are organizations beyond just what is mandated and regulated for institutions to do. People are going above and beyond. And that's what we have to continue to find for ourselves as an institution. And I think this is why there are 5 things that I think are really important in making sure we can sustain. 1, we have to have amazing, bold leaders. And we have 2 right here who have been very clear that this is not just language, not just words, that it is aligned with our mission in the institution that I want to lead, or I want people to follow me as I am leading currently. And so it is really important that you have an amazing and bold leader in ensuring that you can sustain equity work. Obviously, there are going to be competing priorities, but the ways in which you can really invest in those in that work is really important. And so, yes, you're going to go out and find funding, but it's also how do you ensure that your own operational budget continues to support it? And we've made that commitment here at One Brooklyn Health, and that I think is really important in sustaining the work as well. The other important part is how do you continue to pour into your staff at every level? This cannot be a top-down approach. Yes, you need an amazing leader, but are you going to reach out to every level to ensure that you're going to build the capacity of folks to have the language, understand the terminology? How do you define equity? How do you even talk about it? Is it social determinants of health? Is it more than that? It is so much more. And so it is a process. And we want to be committed to that process. We want to make sure that it is not going to just sit in a C-suite, that it's going to be on our units, it's going to be in our ambulatory care, it's going to be in our maternity ward, because we are that committed to ensuring that every single person who walks in, regardless of their religion or affiliation, regardless of their race, ethnicity, regardless of their sexual orientation, that they understand that the place that they are standing in, that they are seen and they are heard and they're valued. That's what we want to achieve. And we want everyone to understand that that is our mission. Those are the values that we, as One Brooklyn Health, we stand on. And we can get there. I think we can.
Thank you.
I hope I set that up all right.
That's a mic
I hope
drop.
that was okay.
We're all done.
You covered it all. Yeah. That was awesome. You covered it all.
Okay.
Oh, we said really? Oh, that was it? Okay.
All right.
Well, I thank you. I thank you.
Okay.
Yeah.
So, my mother says,
I'm like, what he said.
the best experience is your own experience. So, learning to fall teaches you how to fall. What fall lessons have you learned within your professional career?
Don't trust everybody. And even folks who have defined themselves as leaders, I didn't consider them leaders because trust was not part of what they did. And, when you fall, my late husband always says, there are no accidents in the universe. And if you fell that day, that was meant to be. But you have to get up. If you got to hold on to something, hold on to someone, crawl to the nearest chair, but you got to get up and show people and those who are around you, even those who may have pushed you down so that you fell, that you're not going to, failure is not an option. You will not fail. That you will continue to meet the challenges head on. But you also are going to learn what it was that happened during that process and use it so that it don't happen again. And then inform all the other folks around you about what it is that caused that fall and how they can avoid it. Or when they do fall, what they can do to get up and keep moving.
Again, what do you say?
How do you follow that?
I'm not topping it. I'm just going to add a little coating to it. I love all of that. What's the adage? Fall 7 times, get up 8, right? You have to keep, if you have the conviction of your dreams and what you want to do, you'll get up. I was actually talking to a president of a college recently, and he was telling me about some of the stumbles he'd made himself. I'll talk about my own, but what he said was, I just realized that he didn't say that I'm either winning or learning, right? He didn't say that, but he did say, I win eventually. And the reason I win eventually, so never, not always when I want it, and I don't always get it in the first round or whatever, but the reason I do is because I know why I'm doing it. And he was talking about how passionate he is about providing access to higher learning for kids from rural and under-resourced background. And so when he's going out and advocating and seeking dollars and funding and recruiting people to provide for this rich learning environment, he's like, I don't always get the one I want. I don't always get it when I want, but I do eventually get it. And I believe that the reason I do is because it's not about me. It's not about winning that one time. It's about the journey. It's about what I'm committed to doing. And so he keeps that perspective. And I was like, I love that, right? Because a lot of times, the younger folks, we were all young ones, right? I may be closer to AARP than Saul. It's the melanin that tricks you. You're hungry, you're ambitious, you're anxious, you want something yesterday, right? But when it's something that's worthwhile and it's big enough, it's gonna take a while sometimes. It's gonna take some, 2 steps forward, 5 steps backward, but you gotta keep going, right? You gotta keep making a step, learn from what happened and alter your course, retool, do something. I think that's important. For me, I would say I could give you a lot of lessons. The biggest lesson I'll give you for me is learning really, really and truly that when you're trying to lead a group of people, whether it's an organization, a unit, a department, whatever, you cannot move. They talk about moving at the speed of trust. It also is a pace of you have to know and really have a gut check on where people are. And if they're ready, if you're willing to take that bold, courageous move and move out, and people are like, yeah, we're right behind you, and they say the words, but you see their body language, they're like, we're right behind you, right? You got to hear that and go, let's talk this out. This is what do we think is going to happen when I open this door? You know, what are we going to take when I take this leap? And let's talk through, you know, the variables. Are we ready to do this? Now maybe you've given them some time to process it because you've been thinking about it. You've been out there for a minute thinking about it. You're ready to go. They may not have. So you got to like get that feeling for them. And if they need more time, as anxious as you may be, as ready as you may think you are for it, they're not. So hit pause, take a breath, and feel and figure out how you get them there. Or if that ain't the right way to go, listen to the cues and figure out that you have to go tack in another direction, right? You're not going to go up that hill. You're going to go around it, right? Because they may know something you don't know. And if you're creating the conditions where they don't feel like they can tell you, then they're just going to let you go out there. And then you're wondering, like, why didn't anybody tell me, right? I thought we were in this together. So I would say that's the biggest thing for me. One of the things I learned is truly, truly listen to what people are telling you, both in their words, what they say, and what they don't say, right? So for me, I think that's really important.
Well, for me, when the question is fall, I'm thinking of failure, and I'm also thinking of the concept of trust the process, and failure is part of the ultimate process of being great. Yes. So everybody that I could go in a few different directions, but when you're in school and you learn about this great person, and then you watch an autobiography, a movie on their life, where you read their life, and you're just like, wow, this person failed a lot or had to go through adversity, but they persisted and they learned from those adversities. So I think it's just knowing that you learn from your falls or your failures, you learn about yourself, you learn where your strengths are. So it's kind of, that's why I think it's, and then you also learn that when you're making plans in the future, yes, this can happen. I didn't see this happening, but this is also a possibility. And if that does happen, you put yourself in positions that if it does happen, it's not going to go too far. Yeah.
Thank you. So Dr. King's question, not my last question, or a quote rather. So Dr. Eastland, you spoke about being bold, and the word audacity has a positive and a negative connotation to it. But in one of Dr. King's speeches that he spoke, receiving his 1964 Nobel Peace Prize, he stated, "I have the audacity to believe that people everywhere have 3 meals a day for their bodies, education and culture for their minds, and dignity, equality, and freedom for their spirits." We're in 2023. This is 59 years later. Everyone talks about addressing social determinants of health. How has your audaciousness contributed to the change of something that remains in existence for 59 years? And what audacious actions have you taken or will take to give reality to Dr. King's audacious belief?
Well, yeah, I'll kick it off. Well, certainly, I wasn't around 59 years ago. Sorry about that. But I will say, what I think, as I think about that question, I think about 20 years ago. 20 years ago, I was sitting in New Jersey. I was sitting in my medical school, and I was telling this story to a group of students because 20 years ago, folks will remember that the Institute of Medicine put out a report 20 years ago documenting the things that we're talking about right now in 2023. When we talk about diversity in our healthcare workforce, when we talk about the treatment of Black and brown individuals in healthcare institutions, this is my first year of medical school. And so here I am at this crossroad because I'm just entering medical school. Just a month ago, I had the opportunity to don my white coat as a first year medical student. And I came in thinking I was going to do trauma surgery. That was my plan. My plan was to go be a surgeon. And I had to begin to think about, well, where is my best role? Given the community that I wanted to serve, I didn't want to live in Seth Boyden Projects. I wasn't going back to Newark that way, but I wanted to, but I did plan to work in Newark, in the community that raised me, which is why I went back to the medical school in my community. And so primary care became my calling. And then I found out, it wasn't just primary care, public health had to be a different platform. Because then I could not only think about clinical aspect, I can think about policy, I could think about practice innovation. There was so much more that public health afforded, and there was an orientation already to social justice that public health afforded and gave a different language, a clarion call to the work that I got to do. And so, when I think about the alignment and, with the civil rights movement, all the way to the movement for Black Lives, I feel very much a part of these movements that have been calling for social justice for vulnerable people all over the world. There is both a domestic and an international calling for this, because we know that people are suffering all over. And so, there is so much more, certainly, that I must do, that I have to do. I'm a baby in this work. But I do feel as though that I am on a path to continue great work that folks who are not in healthcare have been pushing for. We're going into August. Black August is coming up. And it really gives us an opportunity to dig deeper into the writings of folks like Mutulu Shakur, Assata Shakur, folks who really committed their lives. You talk about conviction, Mr. Finley, committed their lives to ending oppression, ending racism. And so, that's what I'm doubling down on as I go into this next month and in this next phase of my work.
Well, since I was around in the 59,
You're gonna keep reminding me.
59 years ago, when I think back, I came from the United States Virgin Islands. We were the majority. So coming to the United States, as we call it, the continent, and then to be treated as though I was not a first-class citizen was extremely disturbing. And being in a Catholic university was even worse in New Jersey, being worse. Because, you heard about things happening in the South, but this was the North. And I had the audacity to challenge Seton Hall University faculty in the manner in which they talked to us two, one who used to be on your board years ago, Dr. Brenda Bennett, and myself, as if we were second-class citizens. This was a university. We were paying. Nobody was paying for us. We were paying our way. But she's still my support. We talk every day, which is still my support. And we made it through. And then to go into the visiting nurse service in New York, I talk about them all the time. It doesn't bother me. But, what I saw in New Jersey was the community being the most important thing. And so I vowed that I was going to make sure that people in the community knew what was going on for their betterment, and came to visiting nurse service and then found some of the same things that were going on in New Jersey, clearly separate, clearly differences in how people, and I had the audacity then to speak up about how patients in the Bronx were treated. I happened to speak Spanish, so I got the Spanish-speaking patients who felt that they were always left out. And then Lehman College, the City University of New York. When I went there 40-some years ago, the manner in which Blacks were denied tenure was unacceptable. And I spoke out. Got in trouble. I won't tell you the names they called me. But I spoke out and then I went to the politicians. See, that's the audacity that one needs. This is a public institution funded by the public dollars. The politicians needed to know what the heck was going on. Some people never talked to me even to the day they retired. But it was important to me. And I wasn't a designated leader. I was just a big mouth with a strong accent, living and, speaking out for what was right because it was right. And it had nothing to do with me. I wasn't up for tenure then. I didn't even have a doctorate at the time. But it was because they were wrong in how they were doing it with some of the best scholars you have ever seen who've gone on to Harvard, went on to some of the top Research One institutions in this country, but were denied because of who they were. At City University, a public institution. And see, we gotta speak up. And that's what the audacity is, to me. Having the guts to say what you got to say when it is the time, not going home and speaking up publicly, writing letters, getting on that phone and calling people, and never, ever mistake the fact that the people in community, when you tell them what's going on, they'll be right there alongside of you fighting on your behalf.
We know that's for sure.
Yes.
Right on. Love it. I have a lot of thoughts. I will tell you. So when I became chair of ACHE, Saul mentioned it earlier. This organization has been around for 90 years. Just celebrate 90 years. 48,000 members around the country and the world, actually. And I'm the second African American to chair the board, which I feel incredibly proud about. But at the same time, I'll say, I know anybody saw Beyonce performing at Coachella, and she said, "Hey, they tell me I'm the first black woman to headline Coachella," and then she goes, "Ain't that about a?" Meaning, I shouldn't be. There's nothing particularly unique about me, and I'm looking at some of these amazing African American women performers are along this wall here, going like, she shouldn't have been the first, right? Not that it was a bad thing she was the first, but she's saying there are a lot of other people who deserve this too. So, all right, so one of the things, I bring that up because they wrote an article about me, and one of the things somebody said about me, which was incredibly proud for me, was a woman said, when he's in rooms, he speaks up for people who are not in the room. And I just felt, I felt honored that is how I'm showing up, because that's what I endeavor to do. I want to be the person who's saying, well, what about the people outside of the room who we say we're trying to serve? Are we doing the right things by them, right? Did we even ask it, right? Did we give them the dignity of that kind of thing? So I do that in all, I try. I'm human. I try to do that in all my walks, and I'll share just a couple, two. When I was a senior leader at an organization in the Bay Area that actually was over all of Northern California, the organization had about 200 senior leaders. There were about four leaders of color, of any color, 2 African Americans. They had about 13 in Oakland, and I was like, how do you not find a black leader in Oakland? I was like, that seems intentional. So what's up with that? So I was not in Oakland at the time. I was in San Francisco, and when I left the organization, the guy who recruited me, who I was incredibly appreciative of, still admire and respect today, when I left, I said to him, can I share something with you? I said, I've worked in a lot of places. I have a lot of friends who work in different sectors. And we often talked about this thing like a glass ceiling and kind of feeling invisible in organizations. I was like, I never felt it until I came here. And I said, I'm going to tell you something that I hope that when you recruit for my successor or for any other role, that just like you gave me the opportunity, that you will give other people of color the opportunity, particularly in this organization that's hurting for it. But I said, I want to tell you something that they may not tell you, which is that it's lonely. And that you don't want to be viewed as the only person who can speak for a group of people, because that's what was happening. A lot of the African Americans in the organization would come talk to me because they felt like they were the only person who relate to them. That wasn't true. And in fact, I like to think I could relate to other people as well. In fact, I do. But it was the point of representation matters. And I was just trying to let them know that was very important, and that was going to be important for their success as they move forward. Fast forward a couple of years, I'm running a health system in Oakland, and our entire medical staff leadership, just like 13 chairs, at the time that I got there, I think we had one person of color, and I think it was an African American man. Actually, I think he had actually already stepped down, so maybe we had none. Anyway, we're recruiting for a chair for psychiatry, and they're running the search, the medical staff, and I have final say. And I'm not involved in the process, but they went through the process and they brought me the final candidate, which was a bad idea. You should actually at least bring me 2. But they brought me the final candidate, and I said, okay. And I said, tell me about the applicant pool. What was the makeup of the pool? Gender, race, ethnicity, all that stuff. and they said it was all Caucasian men. And I went, huh. So where did we advertise? How did that happen? What did we do? And they shared some stuff, and I said, this is not good. I said, but you've gone through all of this. I will interview the candidate, but I will tell you, don't do this again. Make sure that you have a diverse pool from which to select. So we reflect through the fabric of our community in every aspect of our organization, and we don't currently. So this should be a priority. So I interviewed the guy, and I actually said to the guy, I said, so it's really important for me that we reflect our makeup of the community, and I want that to happen everywhere. So how do you feel about this? And the guy said, that's interesting. He worked in another state. He said, when I was recruited for that role, they asked me, how do we increase the diversity of our medical staff leadership? And he said, easy, stop hiring old white men. And he fit the phenotype. I was like, wow, that's a bit harsh. That's not necessarily what I meant, but I appreciate that you have a sensitivity to this, and actually had a great interview with the guy and actually gave him my endorsement. He ended up being re-recruited by his organization, so he didn't come. So I said, listen, going forward, open the pool. I don't care if the person who ultimately gets selected is, I should say I don't care, but if the person who ultimately gets selected is a Caucasian male or a Caucasian woman or a person of a different ethnicity, I don't care actually. I want us to get the best person, and I think the way by which we get the best person is ensuring that we cast a wide enough net that we get a representative pool, and that we're intentional about ensuring that we present opportunities for people to reflect our community. I think that's what we're talking about. When you have the opportunity, how are you choosing to do that? Some people are vocal, some people are a little bit more silent. You can lead in many different ways. But if you get the opportunity, and I'm going to say again, leaders or titles, that's a noun. I don't care about the noun. People who lead is a verb, and that's all of us. You get an opportunity in many times. Sometimes you may not be ready for it, but you got to step out and take that opportunity and say, speak up, as you said, in the moment, not later, not to people who don't have an ability to influence it, because now you're expressing your frustration, but take the chance, say it, and you'll be surprised. A lot of people will actually agree with you. They'll often say to you, I'm glad you said it because I was thinking the exact same thing, right? So I'm encouraging you to do that. I'm saying to you that that's how I try to do it, and I don't always get it right. I do not always get it right. I don't think any of us do, but I hope that when you have the opportunity to be one who leads, that you'll do this, you'll do that.
So this is my last question, but we are then going to open it up to Macon, Georgia. We're going to open it up to Brookdale, Kingsbrook, to whoever's on the line who wants to ask a question. So, Dr. Eastlund, I'm going to ask you to answer this question first, all right? Because they're always talking about the youth. They say the youth is our future. And, I listened to some podcasts, and there was a lady on, and she said that she's been listening to commencement services for years so that she could have this information to share with her children. So the youth is our future. What would be your message of your commencement speech to graduating seniors entering the workforce?
My message right now, I spoke to class at Columbia and to Sinai just recently, and it was what I wanted them to understand was their responsibility, and particularly it was Teachers College at Columbia, and they have a long history of advancing social justice, and so I said to them that you already have been given and equipped with the tools to really advance social justice. But I really wanted them to understand that it was incumbent upon them to make sure that they were going back and bringing others with them. Because this momentum, this movement that is happening, they need others. They need folks, their allies, they need folks who are going to stand by them and continue to push this work. And so, that's what I would continue to say. The very first question when you talked about, what did we learn coming out of such a challenging time? And it was community. We cannot do this alone. And that's my message. And that's what I continue to say to students. And, whatever project that you're working on, you're working in a system, what's your group project? Who's showing up? Who's stepping up? Who's going to be the leader in that group? But how are others performing with you? Or, you're thinking about, an initiative that you're running, how are you bringing others along with you? And I think those are the skill sets that even in institutions, I think we have to really develop and continue to work on. Because what we found, certainly during in the health department, we found that there were certain leaders who were ready to step up. People who did not have a director title, who were not managers. I mean, folks stepped up in amazing ways, and you've seen it, countless ways. Running vaccine test centers, running some of our outreach campaigns. Folks who did not, I mean, literally, they were making, in some cases, below living wages, and they were amazing leaders. And they did it in a way because they were listening to folks. They really just leaned into teamwork. It was not about them being the leader. It was really about making sure that everyone on the team knew what their job, knew their responsibility, and equipped them with the tools that they needed to execute. And so I think that's what we really want to continue to focus on. And that's what that's my message and was my message as I spoke to students during the commencement address.
Thank you. Dr. Georges?
I gave a commencement speech in May at a Catholic college. I didn't say all the things I said to you. But one of the things I said to those students, they were not as diverse as I would have thought it would have been in Pennsylvania. But I said to them that they've got to learn to live their life with passion. And they've got to commit to something. And one of the things that I wanted them to commit to was raising their voices for social justice. But I also wanted them to dream and believe in magic. And I wanted them to reminisce about all the good times they had in college, but that they needed to look ahead of what their role should be in the future in this country and what they needed to do to change what was happening in this country. And I also said to them that I also wanted them to make every moment of their life count. And that's the message I gave to them because I wanted them to be very clear. See, I firmly believe the young generation, the millennials and the Gen Zs and whatever else they call them after, is our saviors. Because they stood up. They were the ones who would, there weren't people my age out there in no Black Lives Matter marches. The young folks were. Well, some of us were. Some of us did it. But most of them were young, your age groups, who did it, your age group. And they're the ones who are going to save, I think, this country. Because they're not going to tolerate this nonsense that's going on, and they're going to raise their voices for social justice. And that's what I told them I thought they should be doing.
Thank you.
I've never given a commencement speech. I'm probably the only one on this panel that hasn't. But
I haven't either.
Yes, okay.
hopefully one day soon. But I think, thinking about that topic, I said if I were to do it, I would break it into two things. The first thing that always stuck to me was there's a proverb, it's an African proverb, it says, if you want to go far, go alone. Go fast, go alone. If you want to go far, take a crowd. So that you can't do it by yourself. You can't do it on your own. There's also a saying that if you have a core group and everybody works together, it doesn't make a difference what the project is. You're going to be it doesn't make a difference what the business is, anything. If you have a core group, everybody works as a team, it's going to be successful because that's the most important thing. It's teamwork, people working together, trust, honesty. That's going to make anything successful. So you want to you're going to take a crowd, but you're going to build a core, and that's you went through school with people, you got to see their character, and you make a decision as to who you're going to move along with, and hopefully you guys will change the world, because those are the key. People working together and trust and honesty. And then also another thing that I always think about is, it's these two things together. It's above all, to thyself be true. So you always have to be honest with yourself. If you lie to yourself, you're never going to be successful. You have to be honest to yourself. You have to, and you have to learn yourself. Okay. There's the book, The Art of War, and the Art of War says I'll be quick, but there's 4 different scenarios. If you know yourself and you know your enemy, you're going to win every time because you're going to pick the right battles. You don't know yourself, you know the enemy, you're going to win half of the time. You know the enemy, you don't know yourself, you're going to win half the time. You don't know yourself, you don't know the enemy, you're going to lose all the time. So you have to, at least the one part you can control is knowing yourself. So spend time knowing yourself and being honest with yourself and learning from yourself and making yourself know what you can do, what you're capable of, what you're not capable of, and being honest with yourself. So that's what it does.
Mr. Finley?
Yeah.
I love all of this. I think I'm, probably a mixture of these. But one thing I didn't hear, maybe you said it, I would say have fun. I probably wouldn't need to tell doctors that, but I think, it's important in life to have balance. And I think, we really need to, life is a beautiful thing, I believe. And I'm not that good at having fun, so I have to tell myself this, so I would tell them, have fun. But along with aligning with my colleagues, I would also say, find your purpose, right? So finding your purpose is really about, understanding yourself and knowing yourself. We talked a lot about Dr. King, and obviously he has mentored and inspired and guided a lot of us. You ever ask the question, who guided him? So I actually just learned this recently, and I was a little disappointed that I just figured this out, or I just learned about it. There's a guy named Howard Thurman. If you guys have heard about Howard Thurman, he was the dean of the chapel at Howard University, but he was a mystic. And Howard Thurman has this speech called Charting the Inward Sea. He talks about everybody having an inward sea, and this whole mantra about inside your inward sea, you have this altar. Nothing gets placed on that altar without your consent. What he's saying is, what is true to you is the only thing that can be placed on that altar. It means you have to know yourself. You ask yourself, what am I after? What am I about? And that can change over time. It's not like it's fixed, right? You get exposure to life and things happen, but you have to stay connected to, at your core, who are you, right? And then that then informs and shapes what you want to do, how you might go about doing, who you want to do it with, all those different things, right? So I think I would say have fun, figure out who you are and what your purpose is, and get at it. That's what I'd say.
And laugh a lot.
Laugh a lot, please. Right on.
So I do want to say thank you very much, panelists. You've just been very inspirational. I feel honored that you are here and that you've shared your wisdom, your experience, your knowledge, your thoughts, your inner feelings. It was just really phenomenal. And you've really inspired me, and you've taught me things, Someone said here, I think, you watch what is said and what is not said. And I truly believe that. I truly believe that. So I just watched how you all presented and the passion that you have with what you said. So thank you for sharing your ideas, your thoughts, your leadership skills, your knowledge, your experience. I also want to say thank you to Ms. Brown, because Ms. Brown has been an inspiration for me. This could not have happened if she didn't agree to it. So stepping out there, putting your head out, possibly getting it chopped off, you take a risk sometimes. But that's what life is all about. Not with you. I'm talking about No. I'm just talking about this, Oh my no.
Dr. Alston.
No, she would never do that.
But thank you as well
Yes.
for allowing us to be a part of your
Thank you,
vision and your
thank you.
dream. This was amazing. Thank you.
Thank you so much. So I don't know, Ms. Lee, do we have any questions from the audience? Anyone here has any questions? And then we could possibly go online. If there's, yes.
Hello, everyone. My name is Ned. I'm a 1199 delegate who has worked here for, if we add it up together, it's 41 years of service.
Really?
So at my tender age at this time, do you still think there's room left for me?
Oh, yes.
This kind of information?
Are you kidding? No, it's never too late to dream. Please keep dreaming, really and truly, because that's what's going to inform what you do next, right? Or what you continue to do, how you do what you're doing differently. Yes, absolutely. Actually, I was thinking about texting my buddies today, like, hey, you guys still dream? You still have dreams? You got to keep going, right? What's next? You've done a lot. And thank you for your service, by the way. But keep dreaming.
Any questions, Ms. Lee? Sure.
Introduce yourself. My name is Colleen Chung. I am a resident physician in internal medicine, but I'm also
so that we can be able to be in this platform, because the view that we see right now may not be the view that we will see in the future.
I'll start. And I will.
She asked about OVH.
Yeah, no.
And I will comment.
I figured. I was going to I was ready to pass the mic, Ms. Brown. And I was also going to invite Dr. Alston, because I think it is really important, given that you created this platform, because I think this is one clear example about how OVH is ensuring that we are advancing the dream, continue to advance the mission by creating spaces like this. And this isn't the only one, right? All of the virtual, the Zoom meetings that we've held, continue to have these conversations. I know Ms. Devonish Lead also did something very similar during Black History Month, because we know it is really important that we continue to provide space to talk about our history. We acknowledge some of the atrocities that happened, but also the dreams and the achievements that we've already achieved, and what we're going to have to do to continue to move that forward. I think that's really important, because that dialogue, as Ms. Nett has always taught me, that history cannot be lost. We have to continue to tell that story. And we continue to tell that story to our new employees, and we will continue to tell that story to our new employees, to the scholars who are going to be working with us, to our communities. We invite them into this space because we need them. We do not continue to provide the best care that we can have unless we're in concert with our community. And we do that in engagement with 1199, East Brooklyn Call to Action, our Community Advisory Board. I think these are clear examples by the ways in which we're going to continue to make sure that the work that we do is informed by this rich history of Bedford-Stuyvesant, Crown Heights, Brownsville, East New York. I mean, there's a lot of history in this amazing community that I have had a chance to really tap into, and I'm really grateful in the way in which the community has adopted me. And I think that's the way that One Brooklyn Health is striving to do that work, because as a new system, what we want to make sure is that our community knows that we're here for them, that we're always going to be there for them. And we're going to do our best by doing this in concert with you. And I think that is really a part of that mission as well. And it's really in the words that that is on our website. And I think that's really important, that we continue to just go back to it and remind, because part of it is creating good trouble, as you mentioned. Dr. Alston.
So, hey, Colleen, how are you? So, what One Brooklyn Health is doing, as Dr. Eastling said, this forum is one, as well as the community outreach that we do. That's another forum. I'm going to use myself as an example. I am now the CNE for One Brooklyn Health. That's another forum. And I thank Ms. Brown for trusting me to be able to present myself as One Brooklyn Health in a forum where the community looks like me, and allow me the opportunity to fall and get up, allow me the opportunity to challenge some decisions that are made, and allow me the opportunity to speak up and to be who I am. So the forum is here, but again, I think some of us said we have to be ready and prepare ourselves for that particular forum. You have to be audacious with thoughtfulness, because not every bowl, because remember, it has a positive and a negative connotation to it. So it's just really ordering your steps and being able to know that this is the time. So I think One Brooklyn Health, because I've been around. I've worked in the New York hospital when it was the New York hospital, not New York Presby. And that experience for me was a wonderful experience, I will say. And it taught me a lot of the things that I know today in regards to working staff and being a leader. And I will also say that I've had leaders that took me under their wings and taught me a lot of things. So, and it comes in all different shapes and sizes and times. So just follow your heart, follow your mind, do what's right, and follow Ms. Brown.
Be next to me.
Yes, that is correct.
So here you go.
So Colleen, and for others, what is One Brooklyn doing? It's all of the things that they said, but it's also continuing to press for, and because you started out with the affirmative action decision, right? Continuing to press for when we hire from the community. Continuing to press our folks who are recruiting our interns and our residents and push them to recruit and select the people who look like our patients. Continuing to challenge everyone who can make a decision about who becomes part of One Brooklyn Health. Continuing to advocate and take you along to advocate, right? Because we all went up on the buses to Albany and we all spoke, right? And I was asked to speak, and then I was told, well, we're running out of time. And I said, oh no, I'm going to speak. And as you know, I talked about not just One Brooklyn, but safety net hospitals, right? And challenged the governor on what she was proposing in the budget. Now, that's a difficult thing to do when you get more than $500 million from the governor, right? And y'all know that. You know, and I've had other colleagues, other safety net hospital colleagues who said, oh, well, I'm not going to speak. I'm not going to call out folks because we get money from the state. And from my perspective, as Dr. Georges has said, you got to speak out when you believe what you're speaking out about is right. And it's not about me, it's about the community that we serve, and it's about all of you who serve our community. And so you, and I know you do, you need to continue to speak out, and OBH will continue to support our staff who advocate and speak out. But the one thing I've said, and you and I've had this conversation, is when you speak out, know what you're talking about, right? Research, get the facts. But I would never say to someone, don't go out and talk about what is right. And that's what One Brooklyn's doing. What we're trying to do is to imbue upon every single person who works for this organization to be an advocate. Not an advocate for yourself, but be an advocate for our community and for our patients and for the right thing. And as they say, speak to power. You are never afraid to speak to power. You are never afraid. But the point is, no one should be afraid. Everyone, when they get the opportunity to interact with those elected officials, with the administrators, with policymakers, tell them what's going on and tell them what they need to do. And that's what One Brooklyn endeavors to do. We want to make sure the message is clear that every 6,000 members of One Brooklyn's family has a voice and they should use it. Thank you.
Any other questions? Yes. Morehouse, in the house.
It does. Thank you for the question, notwithstanding the fact that you want Morehouse. No, I'm just kidding. I like Morehouse too. So in my example, my why actually did not change. My what and the how I was doing changed. But to address your question, whys do change for people, and I think it's important is the point about knowing yourself, right? If your why is changing because you have learned more about yourself and now what you thought you were, who you thought you were or what your purpose is changes, listen to that. Listen to it. I mean, you might want to fight it, or you might want to at least challenge it to make sure that, you're not getting like bad signals. But if it's true, if this signal is coming to you, and it's you can't ignore it, then don't. Lean into it, right? And we were talking about this a little bit earlier too. I believe in the philosophy that when you make up your mind to do something, the universe conspires to make it happen. I think that there is there's hardly a rational justification for a lot of the things that I've been able to do. Obviously not on my own. I did not do anything that I do, anything on my own. I enjoyed a lot of support. But what I believe is very true is when you put out in the ether a really fervent decision that this is something you believe in, your why, and you want to make it happen, it's crazy. You won't even notice how things are moving in a way to facilitate that happening. So I was going to say, if it changes, especially as you're growing and maturing and learning more about yourself, that's okay, actually. There's absolutely nothing wrong with that. It's probably good, actually, that is happening, because your thoughts about what's possible or what you want to do and what you're capable of doing, what you're passionate about, are just maturing. They're getting better. Yeah. So that's what I would say.
Can I say one thing too? All right. Listen, your why, you graduated from Morehouse. It's answered. All right? My son graduated from Morehouse, and I've watched him. I watched how my son, once he stepped over that threshold, his whole persona changed. It was just something that I don't know what it is that they embed in that education experience, but his whole conversation, his whole frame of thinking was different. And the other thing is also, as I said, I've had some experiences, and for me, every obstacle that I push aside is one less obstacle I see that my kids have to experience. So just keep going. Just know you can do it, and it will be there for you. Any other questions? Okay, so I want to thank everyone, and I want to thank this magnificent panel. I truly, truly mean that, and thank you, Ms. Brown, again for this opportunity. It's been very magical for me, very magical, inspirational, and very thought-provoking. So thank you so much. Thank you.
Thank you. It was an honor.